Your heart is one of the most vital organs in your body, and if it's not functioning properly, it can lead to serious health complications. So what are the distressing signs that your heart may be in trouble? Here are 9 signs to pay attention to. Number 1. Chest pain or discomfort. Chest pain is the most common and well-known sign of heart trouble. The pain can be a dull ache, a sharp pain, or a feeling of pressure or tightness in your chest. Chest pain can be caused by various factors, including heart conditions such as angina, myocardial infarction, or pericarditis, as well as lung problems or pneumonia, or pleurisy and gastrointestinal issues such as acid reflux or gastritis. Other causes of chest pain include anxiety, panic attacks, and physical injuries. Most importantly, chest pain should never be ignored as it can signify a serious underlying condition. So if you experience chest pain, seek medical attention immediately. If medical help is far from your reach, you can take steps to alleviate the discomfort. If the chest pain is caused by acid reflux or gastritis, antacids or acid blockers may provide relief. Deep breathing and relaxation techniques can help with anxiety-related chest pain. If the pain is due to a physical injury, such as a muscle strain, rest can help reduce inflammation and alleviate pain. Also, try to avoid any activity that worsens the pain. Number 2. Shortness of breath. Shortness of breath is another common sign of heart problems. If you're having trouble catching your breath or feeling like you can't get enough air, it could be a sign of heart failure, pulmonary edema, or a heart attack. Shortness of breath, also known as dyspnea, or a common symptom that can affect the heart in several ways. When a person experiences shortness of breath, their heart rate may increase to compensate for the reduced oxygen levels in the body. This can put extra strain on the heart and make it work harder than usual. Additionally, shortness of breath can cause the heart to enlarge, further impairing its ability to pump blood efficiently. This can lead to various cardiovascular problems, including high blood pressure, heart failure, and arrhythmias. You'll be risking the health of your heart when you ignore these symptoms, so once you start to feel uncomfortable, seek medical attention immediately. Number 3. Rapid or irregular heartbeat. A rapid or irregular heartbeat, also known as palpitations or arrhythmia, can be a frightening experience. It happens when your heart suddenly races or beats irregularly, making you feel like it's about to leap out of your chest. This could be a sign of an underlying heart condition, such as atrial fibrillation. Fortunately, there are some home remedies you can try to help sort out the issues. Before contacting a medical professional, one effective remedy is deep breathing, which can help calm your body and regulate your heartbeat. Another remedy is drinking a glass of water, which can help flush out any excess adrenaline in your system that may be contributing to the palpitations. Additionally, getting enough rest, reducing stress, and avoiding stimulants like caffeine and alcohol can help prevent and treat palpitations. Number 4. Fatigue. Feeling excessively tired or weak isn't a good thing at all, because it could be a sign that your heart is not functioning properly. Fatigue, or the feeling of tiredness or exhaustion, can have a significant impact on the health of the heart. When the body is fatigued, the heart has to work harder to pump blood throughout the body, which can lead to an increase in heart rate and blood pressure. Over time, this increased workload can cause damage to the heart muscle and increase the risk of developing heart disease. Additionally, fatigue can also disrupt the body's natural sleep cycle, leading to sleep deprivation, which has been linked to an increased risk of heart disease. Aside from disrupting the natural sleep cycle, fatigue can also lead to unhealthy lifestyle habits such as physical inactivity and poor nutrition, which can further increase the risk of heart disease. So it is essential to prioritize rest and take steps to reduce fatigue, such as getting enough sleep, exercising regularly, and managing stress to maintain a healthy heart and reduce the risk of heart disease. If you're always feeling tired, even after getting enough rest, seek help before it gets too late. Number 5. Dizziness or lightheadedness. If you're experiencing frequent episodes of dizziness or lightheadedness, it may be a sign that their blood pressure has dropped suddenly, causing a reduction in blood flow to the brain. This can happen if the heart is not pumping efficiently or if there is a blockage in the blood vessels. A sudden drop in blood pressure can also lead to fainting. In addition to changes in blood pressure, dizziness and lightheadedness can also be caused by heart rhythm disturbances, such as arrhythmias. These conditions can cause the heart to beat too fast, too slow, or irregularly, which can affect the delivery of oxygen-rich blood to the brain and other organs. Number 6. Swelling in the legs, feet, or ankles. Swelling in the legs, feet, or ankles, also known as edema, can be a sign of heart trouble when the heart is not pumping effectively. Fluid can build up in the body, causing swelling. If you notice any swelling, especially if it's accompanied by other symptoms on the list, seek medical attention. Number 7. Nausea, indigestion, or vomiting. While these symptoms are commonly associated with gastrointestinal issues, they can also be a sign of heart problems. If you're experiencing nausea, indigestion, or vomiting, especially if it's accompanied by any of the other symptoms on this list, seek medical attention. Number 8. Pain in the neck, jaw, or back. Did you know that pain in the neck, jaw, or back could be a warning sign of heart trouble? It may interest you to know that these seemingly unrelated symptoms could be your body's way of telling you something's wrong with your heart. When your heart is at risk, it can cause pain to radiate to other parts of your body, such as your neck, jaw, or back. This happens because the nerves in these areas are connected to the same nerves that serve the heart. The pain in the neck, jaw, or back may be accompanied by other symptoms such as chest pain, shortness of breath, or fatigue. So if you're experiencing any of these types of pain, pay attention to how you feel in your heart and seek medical attention to make sure that your heart is healthy and functioning correctly. Number 9. Cold sweats. Cold sweats in the heart can be a very concerning symptom for many people. It is characterized by the sudden onset of sweating, often accompanied by chills and shivering. Despite feeling cold, this condition can occur for a variety of reasons, ranging from medical conditions to emotional triggers. Of course, you shouldn't fold your hands and watch it destroy your heart completely. Anxiety is one of the most common causes of cold sweats in the heart. When we are anxious or stressed, our bodies activate the fight or flight response, which triggers the release of adrenaline and other stress hormones. These hormones cause the heart rate to increase, blood vessels to constrict, and sweating to occur, among other psychological changes. As a result, you may experience cold sweats in the heart when you're feeling anxious or stressed. Another potential cause of cold sweats in the heart is a sudden drop in blood sugar levels. This can happen to people with diabetes who take insulin or other medications to lower their blood sugar. When blood sugar levels drop too low, the body may react with sweating, shakiness, dizziness, and other symptoms. If you have diabetes, constantly monitor your blood sugar levels to avoid these complications. Sometimes cold sweats in the heart may be a symptom of a more serious medical condition, such as a heart attack or stroke. These conditions typically present with other symptoms, such as chest pain, shortness of breath, nausea, and vomiting. If you experience these symptoms, seek medical attention immediately. Other potential causes of cold sweats in the heart include side effects of medication, infections, hormonal imbalances, and certain neurological disorders. In some cases, the cause may be unclear and further testing may be necessary to determine the underlying issue. If you're experiencing cold sweats in the heart, pay attention to any accompanying symptoms and seek medical attention if necessary. You can also practice self-care and stress-reducing techniques to help manage anxiety and other emotional triggers that may contribute to this condition. Eating a healthy diet, doing regular exercise, and getting enough sleep can help reduce stress and anxiety levels, which may help prevent cold sweats from entering the body. There you have it. 9 distressing signs could mean your heart is in trouble and needs urgent care. However, these symptoms can be caused by various factors that may not necessarily be a sign of heart trouble. But if you're experiencing any of these symptoms, especially if they are severe or persistent, try a quick and reliable home remedy or seek medical attention immediately. Remember, your heart is the home that houses your entire life, and as such, needs to be treated with care, so don't ignore the warning signs. Your heart will thank you. Thank you so much for watching, and don't forget to like, comment, and subscribe to our YouTube channel so you don't miss out.